Okay, we had just finished up our segment on the Morning Blend with Dr. Stephen Anderson and John. How you doing?
Fine.
We made it all right. Everything was good. So, want to just talk to you quick about what we talked about on the Morning Blend, which was the knee replacement surgery, and kind of what your experience was, and kind of what your thoughts are on it, Dr. Anderson. You had both knees replaced.
Right.
And you were in pain. You used a brace. You were taking Celebrex. You were using a cane, and once you had the surgeries, you were able to start doing the things that you used to do or wanted to do, which was riding horses and gardening and things like that. Can you kind of just tell us about maybe your liberation from pain and kind of the freedom that it allowed you going forward in your life after the surgeries?
Well, as I had said prior, expletives are not sufficient in my vocabulary to say what this has done for me.
Yeah.
Suffice to say, I'm exceedingly pleased and happy with the liberation I have. I can do everything now that was only a thought prior.
Yeah.
You know, there were many things. Simple things like going to the state fair or going to the mall, because I couldn't walk. I couldn't move that far. You know, if I could go a half a block, that was whoopee time. But now I have to wait for my wife to catch up to me as I walk around the malls. So it's fabulous.
Dr. Anderson, why do you think people might be putting off this kind of a surgery, whether it be a knee or a hip or things along those lines? Is there any misconceptions out there that you could clear up, or what are your thoughts on that?
I think it's a human characteristic to sort of fear the unknown, and it's hard to say whether it's the rumors of how painful it is, or how long it takes, or the hospital stay, or even just giving up control for the couple hours of surgery, or there are 3 or 4 days in the hospital, has a lot to do with people saying, you know what, I think I'm going to wait until I can't take another step. And very commonly, and you know, John is a great example of there. Sometimes it just boils down to a quality of life issue. And right now, when John's knees were so bad, we have a better knee on the shelf than he was walking around with. And until the patient gets to that point in their life when they say, you know what, I think I'm ready to endure the risk to live a better life from day to day. Before the operation, every day, unfortunately, things get worse. After the operation, for a year or two, things literally can get better day by day, week by week, month by month. And John is just a great example of how well you can do.
And John, you're in your 70s, but what's the average, typical age for these types of surgeries? And what are you seeing younger people coming in as well?
Average age is late 70s, so John was actually kind of a spring chicken at 70, 71 or so, and the average age is about 78 or 79, but as the years go by, as our technologies and our techniques improve, we see more 60-year-olds, more 50-year-olds, occasionally 40-year-olds. Hip replacements I've unfortunately done in 30-year-olds that really were at a point, once again, where their lifestyle that they wanted to lead just wasn't being served by their arthritic joint anymore.
Yeah. So, John, if you had to tell somebody that was even kind of contemplating this, what would be your kind of your advice to them?
Do it in a heartbeat.
Yeah.
That's it. Absolutely. The quality of life that you get back, as I said, is just words are not sufficient, and the expediency in which the recuperation time, the minimal, and I mean minimal amount of pain involved. The horror stories that were of years past are just not so.
Yeah.
It's just beautiful.
And Dr. Anderson, I mean, we talked about this earlier. A lot of people think that you're going to be laid up for a long time after a surgery, whether it be knee, hip, whatever it happens to be. But you're literally getting these people up day of surgery or the next day to avoid any complications.
Exactly. We have motion machines, particularly for knee replacements, that are started on oftentimes in the recovery room. They wear it that night. They could be out of bed in the evening if they wanted. Everybody walks the next day regardless, because the only thing that can happen when people stay in bed is they get sick. So the sooner we can move them, the better. And very commonly, they're walking, they might be riding an exercise bike, and within a week or two's time, they oftentimes can walk without the cane or walker, maybe for 2 to 4 weeks, 6 weeks sometimes, but the sooner we can get them to back to a better gait, oftentimes the better. So it tends to go faster than even 5 or 10 years ago.
Okay. And last question. Seeing something like this, the recovery of John and what he's been able to get back, the satisfaction level for you has got to be pretty amazing. And doing a show like this today has to kind of bring it about for you a little bit to kind of see, in here, what he's been able to do after the surgery. I mean, is that got to be a kind of a cool feeling for you?
Sometimes we probably get a little, it loses the shine that it did when we first started doing these, but our results are uniformly so good. There are always complications to anything, but I think to be able to get back to doing things and live a life that the rest of the patient is able to do if they just were without that arthritic knee or the arthritic hip. The technology is amazing, and it's an honor and a privilege, particularly to work with folks like John, who are so well motivated. You know that they do their part and they get great results, and it makes coming to work a lot of fun on days like that.
Well, thank you both for coming in today, and you guys did a great job on the morning blend, and hope to see you guys soon.
Yeah.
Thank you.